Hello, everyone. My name is Erica Donison. I'm a member of the Alexander Studies online team. Today, I have the pleasure of speaking with Alazne Larrinaga, who has just completed a MSc Master's degree in Exercise Physiology and Therapy. And as part of that, she carried out a research project evaluating the role of the Alexander technique in exercise participation for cancer survivors. So we're going to get on to talking about that in a bit. But firstly, welcome, Alazne, and thank you very much for joining us on ASO. So before we start, I wondered whether you could perhaps say a little bit about you and what the Exercise Physiology and Therapy Masters is about.
So after training as an Alexander technique teacher, I felt that, I needed a little bit more of reassurance or a little bit more of something more scientific to prove my knowledge, to say, or how I could help the general public. So I wasn't a nurse, I had a business background. So I wanted to know a little bit more. We had a little bit of anatomy studies during the training, but I wanted to know more about the physiology of the body, how the body works inside, not the bones and the structure, but how the vessels, the oxygen, how it flows. So I decided to do this master's in exercise physiology and its application to therapy, because during the master's, what you learn is about the body and the heart, how it works, all the cells and so on. But then you learn how to do VO2 max tests and how giving exercise as therapy to the general public, let's say to people with cancer or diabetes or COPD problems or cardiovascular problems. We would give them a certain amount of exercises to do, and then we can scientifically or take some tests and see what's the difference after a while doing exercise. So instead of giving people pills to say that they might need as well, if they have had a stroke or something, maybe people are in statins or something, but using the exercise as therapy, I thought it was a great idea. And I also thought since the beginning that the Alexander technique would have something to do in there.
Yeah, that's really interesting, isn't it? Because we do so much anatomy, but then there is all that much more detail in how the body works that, as Alexander technique teachers, we don't necessarily need to know, but it's all there to be found out and applied in what we do. Brilliant. Okay, that's really helpful. So what I'd like to invite you to do is to go through the presentation that you've done. I'll just say that Alazne did this at the Congress recently, and for those of you who attended the Congress, it will be on the recording from that. But for those of us who weren't there, this is opening this up for obviously the ASO audience. So yeah, I'll allow you to start screen sharing and go ahead with your presentation. Thank you.
Thank you. So yeah, I try to explain now what I did during for my little thesis that I did at the end of the Master's in Exercise Physiology and its application to therapy. Here I am with my participants. Nice picture. This was the first day where we started to give them Alexander technique lessons, and my thesis was called Evaluating the Role of the Alexander technique in exercise for cancer patients. So this is the poster that I did at the end, and I presented also here in the Irish annual meeting for cancer research, thanks to my supervisor that she brought me there, because they find it quite difficult to find different therapies or what to do with cancer. There are lots of, they are finding that now there's immunotherapy and other things that are improving cancer, but they are looking for new things. So my supervisor brought me there for them to see that maybe the Alexander technique can be helpful as well. But I'm not saying here that it is, or this is only the start. The background of this thesis was that research has shown the efficacy of exercise training in cancer, because exercise is supposed to improve the quality of life, reduces fatigue, nausea and diarrhea, and increases the functional capacity and psychological well-being and self-esteem of the people. These are all symptoms of the cancers, and it's proved that exercise is supposed to improve all these symptoms. So it is suggested also that decreases the risk of reappearance of some type of cancers and decreases the risk of chronic diseases. We know as well that the Alexander technique intervention has a positive impact on physical skills, emotional, behavioral, and psychological well-being. So hopefully the combined effects of the Alexander technique and exercise classes would improve muscle tone, thickness of muscle, and flexibility. And we have a study by Cream that shows how the Alexander technique benefits the exercise performance as well. So what was the aim of this thesis or this project? The aim was to create a community-based Alexander technique and exercise program for cancer patients to be able to help cancer patients in their recovery and to get a better quality of life as well. So which were the methods and materials that we used? So we had 11 participants for this project. They were female participants and they were ages 42 to 67. They were previously diagnosed with cancer and they had completed their treatment for breast cancer. They were, in this case, they were all breast cancer patients. So they were given a one-to-one exercise program that they had to do at home. And also there was an exercise program consisted on one day in resistance exercise at the gym, and we would be there, myself and our colleagues. So it was a supervised resistance exercise program that we had to meet in the gym once a week. And then they would have home-based exercises for flexibility and balance that they needed to do daily. This was all done in 12 weeks, so 3 months. And it was in collaboration here in Galway with Road to Recovery, where they were doing their aerobic exercises as well. So they were rowing here in the canal. So as the American Society for Sports as Medicine says, so American College of Sports Medicine, says that the minimum amount of exercise we need to do to be healthy or to continue healthy is 150 minutes. So we were following the ACSM suggestions. They are leaders in the world at this moment. And these ladies were measured on the first week, the week 6, and also the final week on week 12 of the program. The tests that we did, there were musculoskeletal fitness measurements like 1RM, which is the maximum weight you can lift in one go, hand grip and back and leg strength, and sit to stand tests. And then there were the balance tests and also the flexibility tests. We did other tests, but I didn't put them here. They weren't in my thesis. So in the week 6 of the program, that was at the middle of the program, so 7 participants of the 11 and the rowing coach assisted to weekly Alexander technique lessons, besides continuing with their exercise program. And the Alexander technique lessons were practice-based where the participants learn to improve their cognitive function and balance. And it helped them to build awareness about the importance of exercise properly done in rehabilitation and recovery. So here we have a picture and how this lady maybe was using herself not at the best way to say, you know, to improve her. So she could cause maybe a little bit of back pain, lumbar pain. She could have lumbar pain. So we gave, during these lessons with the Alexander technique, we try to help her to get a better posture and then to get rid of the lumbar pain while doing these exercises. That's what she said. So we got some quantitative results. So here in chart 1, what we can see is in the x-axis, we have the participants' numbers, so participants 1 to 11. And in the y-axis, we have the weight that they could lift for this 1 RM is very usual in the exercise world. So it means just how much weight you can lift in one go, the maximum weight you can lift. And here the participants 1 to 7 were the ones who had Alexander technique lessons. And the blue line is the measurement in the week 1. The orange line is measurement in week 6. And then the gray line is the measurement in week at the end of the program, week 12. So in my eyes, and what I can see here is that the overall improvement in participants 1 to 7 was higher. Or well, I wanted to see that this was because of the Alexander, that because they had the exercise plus the Alexander technique. But my supervisor said, well, this was because they did, it could be because they did more exercise. And I said, of course, but why did they more exercise? Because they had the lessons, but this is not that easy to prove. So and then we did more tests, of course, and I just put the charts here of some of them. And this is the charts that I used in my poster. This was the chest press, another one. Then there was the leg curl, and again measuring that 1 RM of each one. And then we have here the sit to stand. This was just sit to stand and how many times they could do it in 30 seconds. So the improvements from the second to the final assessment is clearly higher in participants 1 to 7, as far as I can see. But we did a measurement that they used for statistics, and that was what it was finding. But after doing all these quantitative tests, we also did the qualitative results. I gave them a form and some questions because science, thankfully, not only looks at quantitative, but also at qualitative. And here I asked them how the Alexander technique helped them during exercises. Did it help them with their posture, with their mindset, with their breathing, or if they were calmer? And in this chart, in the y-axis, we have the participant number, and that's where we would put how, in what aspect it was helping them more. So in this chart 8, reveals how 100% of the participants found the Alexander technique help them with the breathing, and 6 out of 7 found the Alexander technique very helpful with their posture, and 80% of the participants, 5 out of 7, found the Alexander technique very helpful doing their flexibility exercises then at home. This was a very interesting as well, I found, and we do this in the Alexander technique training, so that we teach someone the whispered A, and we taught them the whispered as well, and how the amount of breaths per minute after doing the whispered it comes down. So we can see here in chart 7 that their breaths per minute came down a lot to help to most of them. So then I asked them for some testimonials, so just to let us know what to have it there printed. And I found it very nice to see that they find the breathing techniques very useful and that their flexibility has improved. And I also found this other one very interesting, that she says, unfortunately, I was only able to attend 2 sessions, but found both of them very informative and useful. I practiced the lying down several times, and I found I was calmer and more relaxed after it. It also feel it may have contributed to improve my sleep. I am now more aware of how I sit and the correct way to do it. Yes, I will continue to practice what I learned and feel it will be very valuable to me in daily life going forward. And this was only person because we did these Alexander technique lessons during 6 weeks, the last 6 weeks of the trial. But I just find that to some people, they don't need to go long into the Alexander technique. They just need a little bit of learning of it, and then it can change. It can really change their breathing or even improve the sleep. That's a big one, especially when you are going through some sickness or something like this. But I have to say, these women were really strong. They were ages 42 to 67, and they were really going through exercise. They knew how exercise could help them with improving their muscle tone, because after they're having radiotherapy or something, your muscles can get weaker. So you really need to work them back. And they were very strong. However, some of them weren't. And I really thought about introducing the Alexander technique after the first day of our trial, when we had a really good, really nice personal trainer teaching them how to do the warm-up. And just when he started to tell them, okay, lunges, and I could see some of them really struggling with the lunges, just go back and do it. I thought, well, I really think that some of these ladies could improve their lunges or whatever of these exercises if they had a little bit of Alexander technique training, and then just while breathing and thinking about what they are doing and improving their proprioception and improving of how they use themselves, that these exercises could be done more easily. So what were my conclusions of this? Individuals who had Alexander technique lessons with their exercise had a larger measurable increment in some tests that we did for this trial. But while these findings may support that Alexander technique lessons combined with exercise programs can be beneficial, further research data is needed. A more rigorous approach in which both control and study groups are subject to the same exercise program, with the only variable being the Alexander technique lessons. Because in this case, for example, the women were following the 150 minutes exercise minimum per week. That actually, as far as I know, as an exercise physiologist, the ACSM now, it has changed that. It has to be 200 minutes minimum per week to be healthy. So that would be it for once, but also that the whole group is doing the same exercises. Let's say one day they are walking, and then the other day they are swimming, and then they are rowing. Plus then all of them go twice a week to do resistance exercises, and then 5 days per week they are doing flexibility exercises and balance exercises at home by themselves, but doing the same exercises. So hopefully someone will take this lead and do a nice PhD or 3. Or I know there are people open to it, because as far as we know, already the Mayo Clinic and the National Health Services in the UK believe and have recommended Alexander Technique lessons as a health enhancing practice, which I'm really happy about. It's not happening yet here in Ireland, for example, and I don't think the rest of Europe. So
yeah, we have quite a lot of work to do, don't we, in getting the acceptance within the health professions. But I think this sort of work is ideal. So the more, even, you know, sort of small studies like this, it's a master's thesis, so it's not a huge piece of work, but it's a valuable little piece in the jigsaw, you know, just gathering the information and the data needed for the medical profession to take us seriously. So yeah, it's a nice, lovely little piece of work. Thank you very much for sharing all of that. I just have a couple of questions. So in your questionnaire to the people who had the Alexander lessons, it looks like from their testimonials, but did they kind of say, oh yes, we found it an acceptable thing to do? You know, they thought, oh yeah, this is an okay thing to do alongside the exercise, because exercise is kind of accepted to be a you know, the medical profession says that exercise is good for so many things, and so they might have expected to do that, but to have the Alexander technique as an add-on might have been a bit odd. So did you have any kind of strange looks or quizzical questions?
One of them knew a little bit of about the Alexander technique, and while they were, for the first 6 weeks, while they were doing the resistance exercises in the gym, I was giving them a couple of tips, and then they found it like, oh, this is helpful. So then when I offered to add the Alexander technique lessons, and I was there with one colleague, she helped me with all of them to put hands on while they were laying down, and then we would guide. It was a very an introductory classes to the Alexander technique for these 6 weeks. Very basic, but that's what we need, and they need it, I think. And so, okay, 7 of them said, and also I was really happy that the coach as well said, yes, I'm coming with them. And they loved it since the first minute. They loved being also nurtured, look after, and then they could do more. And some of them, they didn't want to come as well. You know, some of them were more fighting, more strong in doing the exercises, and they really didn't want to be looked after that way, or maybe they couldn't. And then some of them, they weren't able to come because they were living farther away. So the ones who came, they loved it.
We know that, don't we? We know what we do is an excellent intervention. So the other question is about acceptance of it. How did your exercise physiology colleagues take to the idea of the Alexander technique coming into an exercise program?
So I didn't ask. At that time, there were colleagues during this thesis, and each of them, they were doing their bits, because I did these musculoskeletal measurements, and others were doing the VO2 max, which means how much oxygen you are able to manage, you know, while you're doing exercise. So they were doing other measures, and we did them together as well, but I didn't use them for my thesis. And but then when I talked to my supervisor, she was curious, you know, and since the beginning of the master's, I told her I wanted to do this to work, for it to work together along with the Alexander technique. But it was very funny when I started the master's, and we had the first week we had the anatomy class, and the teacher was coming walking like this with a lumbar pain that he couldn't even move. So we have all these doctors, and they know a lot about bones and structure, but they don't really know how it works or how it can work easier. So I think the Alexander Technique teachers will have a lot to give to them, and they have a lot to give to us. Like it's an exchange.
Yeah.
And but especially with cancer, and at the moment I work at CRE here it's a charity where people with cardiovascular diseases come. So they have the same problems, and I have people from the age of 40 to 84. Whenever we are doing the warm-up or anything, I am always introducing the Alexander Technique through exercise to them. They don't even know that it's Alexander Technique, because that word puts people like, what? And it has worked both ways. I had private students in the Alexander Technique. Now they have joined the exercise classes where I give them, even without having any cardiovascular issue, but they want to come to those exercise classes. They don't want to go to other. And now I'm starting to do smart yoga as well. So I do the yoga, but with the Alexander Technique.
I think this is the thing, isn't it? It's the fact that the Alexander Technique underpins everything we do, means that you can apply it to, well, everything we do. And actually, probably the more kind of research where we start to work alongside other interventions, the more we can demonstrate that. And as I say, this project just shows that, which I think is really, really valuable. So that's great.
To do something like this, you need lots of, well, sometimes you don't need too many devices or a big investment, but you really need a researcher to lead it. And that be costly. So if you do it already with something that it's in there, and you just go with them or join them, even if now we have the Alexander Technique and Science group, which is fantastic. And there is a lot that we can do, as well as not even taking to research, but even working in communities or.
Brilliant. So just to say that alongside, as part of this post, there will be a link to Alazne's thesis, which is on our Zotero database. So you can click on that and read it. And is it okay to say that if anyone wants to get in touch with you to ask about it, they can? And also the question about, is anyone else doing anything like this sort of work where we're introducing the Alexander Technique into something else, another intervention? Let us know, and we can find out more about that. We'd love to hear from you if you're doing something similar or have ideas about doing something similar. That'd be really good. So just to say thank you ever so much, Alazne, for sharing this with us.
Thanks to you.
And and yeah, it's been lovely to talk to you.
Nice.
So, thank you.